Now, coronavirus cases, I had mentioned earlier, have now topped 5 million. And a new study, an alarming new study from the American Academy of Pediatrics, has shown that roughly 100,000 children have tested positive for coronavirus in just the last 2 weeks of July. I want to make that very clear. In just the last 2 weeks of July, that's about a quarter of the total positive cases that they found in this study. Now, this is coming, of course, as cases continue to rise in Puerto Rico, Hawaii, South Dakota, and Illinois. So for more on this, we're joined now by Dr. Andre Campbell. He's a professor of surgery at UCSF. Doctor, thank you so much for joining us. So we have this new study here that shows 100,000 students have tested positive for coronavirus. I mean, you hear that number. How alarming is that? I know that, children are not too badly impacted by the coronavirus we've been hearing, but how alarming is that number? And do you think that schools are going to be these super spreader zones going forward?
Well, first of all, good afternoon, and thank you for having me on your program. I really appreciate it. We are very concerned about the impact that the virus has on children in the United States. Now, there are other countries that have done it right, and I think, in fact, we've done it wrong. We've had major issues in the way that we have approached the virus because we don't have a national policy. So what happens is different school systems are dealing with things individually. So you probably heard about the North Paulding School in Georgia, where the student was courageous enough to take a picture and post online about the big crowds there. And what has happened is now there have been 9 cases because of that. Nobody wearing masks, no one doing things, and what have you. And this new study you're talking about really makes us even more concerned because there's large numbers. So what happens is schools and districts that have not got to the point where the community spread rate is less than 1%, 2% like it is in New York and other areas in the United States that have been successful, that it is potential for there to be significant spread. Now, there's rumors and innuendos that kids are not affected as much, but that is not the case. I mean, in the younger kids, there have been some reports that maybe they may not be significantly affected, but as we get more data, more kids go back to school, it's gonna really change the way we view this. And this new study saying that there's so many kids affected is a big deal. 100,000 children being affected is a big deal.
So I'm glad you mentioned that national policy. I want to get to that in just a moment. But on that point about whether children are actually, impacted by this virus or not, as a part of this study, they were saying that there is something called MISC, that's multi-system inflammatory syndrome in children. I was reading that children were dying from it, and this is something that we talked a lot about in adults just a couple months back, of course, when the pandemic really fully hit the United States, that it is disproportionately impacting minority children. So Black and Hispanic children are being disproportionately impacted by that MISC. I'm wondering if you can, I had never heard of it, of course, until reading about this study. I'm sure many people watching have not heard about it and might be similarly alarmed that their children could be impacted by something like that. Could you just quickly walk us through what that is and why and how it's impacting kids?
So first of all, there was a lot of we're still learning every day about what works and doesn't work and how this disease presents. There's SARS-CoV-2, COVID-19 infections that are going on. So what was found by a group of investigators from, I think, the Cohen's Children's Hospital in New York and other places, that they found that kids got a multi-system inflammatory syndrome where it infected their heart, their lungs, their kidneys, and so forth. And they got quite sick overall, so that they ended up in the ICU. So what happened is the Children's Hospital intensive care unit doctors sounded the alarm. There were basically public health warnings that went out saying that this is a thing that can happen. It is not only in adults where things get really inflamed, starting with the lungs and going to other areas where it becomes major problems. Now, the issue of disparities is a big one. Now, there's data in terms of disproportionate impact of different disease processes on African American, Latinx, Native American communities, and that is the same thing for COVID as it was for cancer and trauma and in other lung cancer and other studies also, where there's a disproportionate impact in African American and minority communities.
So, Doctor, about that point on the national policy, because the debate seemed to be, at least when it came to schools, that each school district should decide. It should be decided regionally based on how many cases, were in that area or in that town or region. Are you saying that there needs to be some sort of one standard when it comes to opening schools?
Well, I think that the information is out there and by communities, and yet communities need to weigh in because that's how school systems are set up. But we need to sort of say the CDC needs to come out and say, if your community, for example, if the community spread is less than 1 or 2%, and there's been some presentation of that data around the country, if it is at that point, it may be reasonable to think about opening it. But if your community spread is 19 or 20% like it is in Texas right now, it is not a good idea to do that, because in places that are having major hotspots that are flare-ups, it is a major problem when you open up the schools and there is a rip-roaring epidemic going on, because these kids and adults can be spread. We talk about how the virus does not distinguish between people when it's infected, no matter what your political background is or what have you, right? Or whatever you are, your ethnic background is, you can get it. Now, what we have found is that in ethnic minority, it is more common, and when you get it, it is worse. The death rate, if you think about this, 1 in 1,300 African Americans in the United States have been killed by this virus. Right? That is a stark number. I mean,
Right.
You're talking about 20 to 30% of people being affected by death from this virus. Of the 162,000 people who have passed from this virus are African Americans, a large number of Latinx also. So this is a major problem.
All right, we will sadly have to leave that conversation there. Dr. Andre Campbell, Professor of Surgery at the University of California, San Francisco. Thanks for joining us today.
It's great to have you today, and I really appreciate you.